Hello, my name is Clay Neves, and with me today is my associate Steve Ekman. And we want to talk to you about some really exciting accounting principles that make a difference in the dental practice. And Steve, you've worked with a lot of dental practices over the years, haven't you?
We have.
About how many have you worked with?
A little over 1,100 dental practices in 11 western states.
And that's a lot of dental practices. You probably picked up a lot of different things that dental practices do right and do wrong to help or hurt them as practices. What's the one thing that you have seen over the course of that time that can make the most difference in the shortest period of time for a dental practice?
I think the one thing that makes the biggest difference in any dental practice is collection.
Oh,
I've found out over the years that you just can't spend production. You can only spend collection. You can produce all day, but if you don't collect the money, it does no good.
so it's more than just doing the work, it's getting paid for doing the work that makes all the
Absolutely.
difference.
That's the big thing.
And what are some of the things that dentists can do then to make sure they get paid for doing the work?
Well, there are a couple of things. First of all, a dentist should never start a procedure without knowing how he's going to get paid.
You mean they do?
Too many times they're in the dental chair and they find work that needs to be done and they want to get to production, so they immediately start doing the work.
Without talking to the patient about how it's going to get paid for
Too
first.
many times.
Just assuming that that'll all work out.
Yeah. And
If
then,
they do the work, they'll get paid.
the patient comes out front and finds out that it was $1,000 and they kind of swallow their tongue and say, gee,
Wow.
I didn't know that.
I didn't know it was going to be that much.
Absolutely.
So get agreement on payment before you start the work.
Never start a procedure without knowing how you're
Okay.
going to be paid. And secondly, the biggest thing I think that is lacking in practice is our financial arrangements. The patient that leaves every dental practice has a financial arrangement. Either the practice made it or the patient made it.
What do you mean by the practice made it or the patient made it?
A lot of times someone will come out and say, bill me, or they'll just sneak out. And if they get out without making a financial arrangement, or the dental practice making a financial arrangement, then the patient made it. And what happens then is that whatever they think that they're supposed to be paying is what they'll be paying.
How do they sneak out?
Well, a lot of times they'll be in a hygiene appointment and they don't need an exam that day, and they'll just walk out thinking that everything was taken care of. Not always the case. The problem being that the hardest dollar to collect in a dental practice is the last dollar.
And by that you mean the last dollar they pay for the procedure.
Whatever's left on that dental chart is the hardest dollar to collect. So my system states that the last dollar needs to come from insurance, that all of the co-pays and the deductibles are collected up front.
Interesting. And that's not commonly done
Well,
anyway?
it's supposed to be, and most practices try to do it, but also most practices are in the situation where they don't want to lose any patients or don't want to have any patients feel bad, so they kind of let the patients right now rule it. In fact, I've had dentists tell me that they're current on all of their receivables, yet they'll have 3 times the normal amount that they produce on a monthly basis outstanding in receivables. In fact, I had one dentist say, yeah, they're all current. And I said, how can that be? You produce $80,000 a month and you've got $270,000 in receivables. Well, he printed it out and everyone had paid that month, but it was $10 or $15 or $20. So,
Amazing.
so that doesn't work.
So they need to get more than that, and they usually have just left it up to the patients to determine what they're going to pay.
Yeah, 2 things have to happen. First of all, they have to have a credit policy that works. And whatever that credit policy is, maybe there's 4 steps. Cash, credit card. We have a lot of dedicated dental credit cards right now.
Right.
And it used to be that if the patient waited long enough, they'd get a 90-day interest-free loan from the dentist. My theory is the last one should be worse than the first one. So the last one may be electronically taking it out of their bank account.
Right.
Well, they don't want to do that, so then they look at the other options. So that's the first thing, is have a credit policy in place. The second thing is ask for payment. I don't know that anybody goes into a dental office expecting not to be billed or expecting not to pay that day. so that the front desk, the person in charge of finances, the dental office manager, whoever it is that is working with the finances, needs to say your charges today are, and then be quiet and let the patient respond.
And what do they usually do?
Well, like I say, most people know that they're going to have to pay, so they either start handing the credit card out or making out a check or something.
Now, you said that like a lot of the desk people will start talking too soon.
Yeah, yes. They'll start saying, they'll start talking about something else, but let the patient respond. Yeah, I can give you a credit card, or I can write out a check, or they may say, I can't really afford to pay that today. That's where you have to overcome the obstacle and deal with that situation.
And
but let them respond first.
And you're saying that it's good maybe for the front desk people to be the bad guys, the money people, and not have the dentist play that role.
Well, it's actually, you want to make that front desk the advocate for them. When they ask the dentist what they owe or something like that, the dentist should reply, I have a financial person that's very good at that. They know all of the ins and outs on insurance. It's their job to see that we get this thing taken care of today. So that when the person comes out and speaks to that front desk, it's not an adversarial role anymore. They're more of an advocate, and they sit down and they say, Clay, it's my job to find out how to get this procedure done for you. Here are the options that we have.
Well, now, am I ever back in the chair as a patient and the doctor sees that I need something done and I'm in the chair and he says, oh, we've also found this, would you like us to do that as well? And I said, well, sure, but we haven't discussed the financial arrangements. What should the dentist do at that point?
Bring in the financial person once again.
Okay, I'm in the chair, so the financial person comes back and talks to me while I am in the chair.
Right.
And we get agreement before he ever does anything more to me.
Right.
And either I can agree with that, or I can't agree with that. And if I can't agree with that, maybe I just don't have that done that day.
Right. And it's
Okay,
not the
we make
ultimate.
other
It's not the ultimate goal to have it done in the chair.
Right.
But obviously that can come up when he finds some extra work to do, or he finds that maybe he had a little more work that he had to do, and it was worse than he thought. Obviously, the thing that we'd like to do is pull them aside, do some financial arrangements on future work, so that when they come in, they know how to pay it.
Excellent, excellent point. And one last question then, Steve. You mentioned that the hardest dollar is the last dollar, and so that should be the first dollar?
Well, what we're doing is, we accountants have really done the dental community a disservice. We accountants have always taught that over 90 days is bad. So if you've got people that owe you for over 90 days, that you ought to go after them. And that's what happened. They start sending collection letters, they start calling, they start asking for payment at 90 days. The problem with that concept is you come to the end of the next month, you print it out, maybe different names, but they're the same amounts. It's not broken at 90 days, it's broken at 1 day.
So the minute they are past due is where we ought to start the collection process.
We need to ask for that payment at the time of service, whatever it may be, whether it's a copay, whether it's a deductible, whether it's the whole amount if they have no insurance. But we need to ask up front so that we don't get out to 90 days.
And most collections are best done 0 to 30.
Absolutely.
And that's the sweet spot of collecting. You let it go past that, we have a much slimmer chance of ever collecting.
No question.
Okay. And you also mentioned that we ought to do the copay, the office visit up front, and use insurance then to pay the last dollar.
Because it's the hardest to collect.
And it's the surest.
Absolutely.
The insurance is the surest payment.
Yes, it is.
So we ought to use the first dollars to get from the patient up front, and insurance to cover the last dollar.
That's
because we know that's going to be
That's the concept.
Excellent, excellent. Any other last thoughts about credit policy or what we're talking about today, and that is not just doing the work, but making sure we get paid for doing the work as dentists?
I would make sure that the patients understand what the credit policy is and they sign off on it up front.
Okay.
So that they know in that practice that these are the options.
So number one, make sure the patient knows what the credit policy is, and have them sign off on it up front.
Yes.
Okay. Excellent.
Thank you.
Well, that's good advice for any dental practice. And maybe you're already doing that, and if so, congratulations. If not, let us know how else we might be able to help you make your practice perfect.